Hi, Nurse Sherry here, and today we're going to be going over the CNA testable skills, performs electronic blood pressure. All right, so we're going to begin our skill by washing our hands, knocking on the door, and introducing ourselves to our patient. Hi, my name is Sherry. I'll be your CNA today. Can you provide me your name, please? All right, Robert, we're going to just do a blood pressure check. Would that be all right with you? Okay, wonderful. I'm just going to grab my blood pressure cuff and I'll be right back. I'm going to provide privacy. I would have washed my hands if I left the room, and I'm going to come back in. All right, so you want to make sure that you have a cuff that fits your patient. So if it's too small or too big, you're going to get an inaccurate reading. All right, so the first thing I'm going to do is expose my patient's arm. I want to make sure that his palm is up when I'm performing a blood pressure. Then I'm going to put my machine here. And if you see this sensor here, this is going to go over your brachial artery. So we're checking the brachial artery so we can find where we're going to put our stethoscope. If you were doing a manual one, okay? But either way, you need to know where you're going to put that sensory airflow. So your brachial artery is on the inside. So I'm going to feel for that. And then I'm going to go ahead and place my cuff. Your cuff should be approximately 1 inch above the elbow. And that sensor needs to be near that brachial artery that I felt. It is important that you feel the brachial artery. There's different types of cuffs. This one slides on. So I'm going to come up. It's about 1 inch above it. This is where my brachial artery was. And I'm just going to tighten it. And my mannequin is a little bit small, but this is the only manual blood pressure cuff. You'll be doing your skills evaluation on a live person. All right, and then you'll have like a start, stop button, things like that. So I'm gonna go ahead and hit start. Okay, just so like that. All right, and as that pumps up, I'll wait. You want to make sure that your patient is not talking or anything during the procedure. And if they're sitting, you want to make sure that their legs are uncrossed. All right, I got my blood pressure. I'm going to go ahead and remove the cuff. Ask Mr. Smith if he has any questions or needs anything. I'm going to make sure that he has his call bell. I'm going to check the bed and make sure it's locked. Put my blood pressure cuff up. I'm going to wash my hands and I'm going to document his blood pressure. So I would write 110 over 78 millimeters per mercury. So that is how it's written. All right.